So hello friends, in this video we are going to see very important scale, that is the GCS scale, also known as the Glasgow Coma scale. This GCS scale is having three components which can be remembered by the mnemonic EVM. E stands for eye opening, V for verbal, and M for motor. And we can rate it as 4, 5 and 6. The eye opening has 4 components, verbal has 5 components, and motor has 6 components. So let us see one by one. Eye opening, it has, if there is spontaneous eye opening, then the score will be 4. If eye opening responding to the sound, then it is 3. If eye opening to pain is there, then score is 2. And if there is no eye opening, then score is 1. Remember one thing, there is no 0 score, so the minimum score is 1 for eye opening. Then second component is the verbal component. If the patient is oriented, then the score will be 5. If the patient is confused, then the score will be 4. If patient is using inappropriate words, then the score will be 3. If incomprehensible sound, then the score will be 2. And if no verbal component is there, then the score will be 1. And let us see the third component, that is the motor. If patient is obeying the commands, then the score will be 6. If the patient is localizing the pain, then the score will be 5. If there is withdrawal to pain, then the score will be 4. If there is flexion or decorticate flexion, then the score will be 3. And if there is decerebrate extension, then the score will be 2. And if there is no motor component, then the score will be 1. So as you can see here, there is no 0. So minimum score for each of the 3 components is 1. So the minimum GCS score will be 3 and the maximum score will be 15. Now there is one very important scale in pediatrics, that is AVPU, pediatric response scale. And this AVPU stands for A for alert, V for voice, P for pain, and U for unresponsive. So alert means awake, active, and responding appropriately to mother and external stimuli. Voice is if the patient is responding only to voice, like calling out child's name or speaking loudly. Pain if the child is responding to painful stimuli such as pinch, and unresponsive, that is child is totally unresponsive. So this is the AVPU scale. This is used in emergency, and there is correlation between AVPU scale and GCS score. So if the child is alert, then the GCS score will be 15. If child is able to make voices, then the GCS score will be if the child is able to respond to the voice, then the score will be 13. And if child responds to the painful stimuli, then score will be 8. And if the child is unresponsive, then the score will be 6. So if we are not able to assess the GCS score, then this AVPU scale is helpful in such cases. And for severity of traumatic brain injury, the GCS according to the GCS score, it can be categorized as mild, moderate, and severe. If the GCS score is between 13 to 15, it is a mild traumatic brain injury. If it is between 9 to 12, then it is moderate. And if it is 3 to 8, then it will be severe. And you all guys know that the indication for intubation is GCS less than 8. And this GCS and AVPU scales represent the cortical functions. So this is one of the very important scale, that is the Glasgow Coma scale.